automated that there is a less chance of error because there are multiple level checks. Everything is checked by, and there is an auto priority. If you have multiple patients, what to be done first, what to be done next, that should be software guided. And there should be smooth shift duty changeover, which we have found. The moment staff changes at 2 o'clock or at 8 o'clock in the evening or in the morning 8 o'clock, there is always a problem. The software should be able to give check a changeover through the system only, not by verbal. So these many things have been done, these many have not been done, they are waiting for this. So it goes like a very good record where anybody can give answer to any problem. Pharmacy online is a very, very important aspect. In a pharmacy is a priority in ICU. If it is not available at the time when we require, then it will be a problem. FIFO base means first in, first out. There should be whatever the drug has come first, it should not be that expired one it is being used. And there should be a priority like put on hold billing. That means there are 5 people who have come to purchase medicine. The ICU one gets priority. Other people can get hold. And pneumatic tube transfer system is good if you have in the hospital, so that the medicine can be brought directly to the ICU department. Alert for optional medicine doses and interaction. Each medicine should be immediately available on the screen with the constituents contains, so that we know that what is the optional one, what are the doses and what are the interactions which are possible. Not that brain of a consultant would tell. There are certain standard things where the software will tell that don't prescribe this because his patient is already on this. That is what is required. And check as per the patient's body profile. That something is 0.5 milligram per kg and patient is 70 and you have given some dose which is absolutely not matching with, software will give an alert. And that is what we have prepared in this ERP. Another problem is that who will check which patient? So login rights, legalities, liabilities and security is very important. Like this particular patient who is admitted under me, who can see it? Naturally, any patient can be seen by medical officer or by internist in charge or by specialist of his team, or maybe his team, like I have got 4 or 5 people, they can see. And referred specialist also can see, but that referred specialist will be given a right only for 1 day or 2 days. Then physiotherapist can also see my patient if I have given right to them. The rights I am giving, not the institute. I am telling, okay, this many doctors or this many specialists can see, billing officer, medical director. And most important aspect of this software is that 12 midnight closing. That means after 12 midnight, I cannot put any findings. If I do something for the previous day, it should be blocked. Because we want to have a sincerity, legality and or security. So the way we are doing in a paper that we can go the previous day and write down something, that doesn't happen. You have to complete by midnight whatever you want to do for today. Critical equipment management is very important for ICU. If the equipments are not working, then who will take care of that? Only software will tell you that it is not time to go for calibration. It's time that you check this, all these equipments which are working, ventilators or whatever the other machines. Then there should be possibility of availability. If a patient has come with a ventilator, do I have the ventilator available? Who will tell? Not the intercom talking. Software will tell that these are things which are available. Crash cart management, very important, that it is always with a loaded, all medicine required and all expiry things have been changed over. And emergency procedure preparedness, very, very important part. In the morning, do I have sufficient number of prayed for tracheostomy? Do I have sufficient numbers for venesection or a central line? Who would take care? The software will tell in the morning. Things have not arrived because there is no check mark. ECG, maybe for imaging, radiology, whatever. Effective communication is a very important part in ERP software. Where in the morning, if the head of the ICU department wants to send messages, he can send messages to either all these people or a particular cadre or particular 2-3 people, and he can give a training schedules. All meetings should be computerized. It's like if I have a meeting of infection control or any other thing, then it is something like this many people will attend, so automatic SMS goes to them. When the meeting is happening, who has been present, and thereafter who has been given which task, and that task will complete what time, and who will supervise. Everything is software driven. So if something has not happened, immediately the director will come to know. Detailed watch on communication as well as auto performance graph which is required. In all this high-end costly treatment in ICU, there is always a problem of billing. So the software should be able to take care of that billing. That means whatever is done with the patient, immediately charges are added. It's not like you call for the file and then you see each page and then you try to pay a billing. So either medicine supplied, equipment given, or specialist doctor's visit or stay or other services, all these things happen the moment. Like if the water bed is given, the moment it is written out is given, the charge is added. So it's not like that you have to check at the end of it. The real-time billing, the dues, as well as there should be smart charge master data. Friends, believe me, all these major hospitals have taken 3 to 4 years to finalize what charge they will take. It's a huge topic. It's so difficult. In this situation, what would be the charge? They always have some lack of information. So smart charge data is very important. Analytical reports should be there in a software so that internal feedback as well as external feedback can be checked, because it's a very sensitive department of the whole hospital, ICU. And infection control measures all should be through software. When there is a scarcity at the central store, the high priority resources should be given to ICU by the software, where all reserves are made for the ICU, as well as there is always a morning check which is automatically happening in the software, where the ICU is really ready with equipments, with supply, with staff and all these things. Friends, we are going to have a talk on this telemedicine, where it is a part where now Dr. Raj Rawal has started with a telemedicine ICU. So we'll be learning a lot, but that should be incorporated in this same software. Now, what are the electronic medical record concern in the world? So many new things I am talking about. Does it happening in the world? Is it so? It's so exciting to understand, but it is happening. So concerns are like you had this written down big chart in ICU, which is now changed by a screen, where you are going to make all these things which happens by the data. So in 2014, there has been a report like 31% adopted EMR EHR in a developed country, because it has helped in incorporating the practice workflow, improve coordination, increase patients' participation, improve quality of care, increase efficiency and cost saving. This has been experienced already in 2014. There is a data that yes, it makes a big difference when you use such software. What this software requires, it has to have a clinical reminders. It should connect the expert for decision making, analyze and aggregate the data for research, interact with EHR system, enhances their completeness, as well as the whole software should be focused on a total health. Then only it can be used in ICU, because ICU is something where we require all data together. We cannot go on taking digital history at that point of time. Now friends, we know that there must be some problem with such software. That's why it has not come so frequently in India or in a developing country. So barrier to adoption is that high initial cost. We don't know what would be the return. Underestimation of the organizational capability, that will this software work. Unfamiliar change of management. The person who has invested 100 crore rupees is also asked to go as per the software. So he feels like that I have to believe what software says. He has to believe. So there is a change over management. There is a virtual manager who says everything and you have to obey. And then only things work. Familiar to redesign clinical process. So that is a versatility of the software which can come. Chances of system become obsolete. So that is a problem, that it might go with a newer platform. And ERP should be properly built, so there should not be malfunctions or destroy of data. Security hacking problems are there. Lack of skilled IT person is a huge problem. And there can be some unintended negative consequences of technology. So all these things are also something in the mind, but it is minimizing day by day as the technology is developing more and more. Today the problem is all the equipments in ICU are having multiple data. All the data comes to the patients, and then there is an information overload. What exactly is important for the patient's care at that point of time or moment? So lack of information, even if there is a lot of information in ICU, so what is required now is you have to have some sort of a reporting where the data volume can be changed to a value. And that happens when you learn lot of things in that ERP. Each software requires a big or longer time and longer interactions, and to be with that, then only you know that you can get extract of all these things where whole volume of data can be brought down to what is the value. These are a couple of the softwares which are recommended in 2018 world over, which are the best one as an ERP for a small practices, not for a large practices. Now, a couple of one point is that you get electronic medical records traditionally. That means software is there which is installed in that particular hospital institute. So that thing has, you can scale only to the limits of your hardware because you have purchased some hardware. So that part only can work. And there is a security concern because you do not know somebody might steal your data. Against that, there is a cloud-based EMR available. Cloud-based means something is in the cloud only. You are not having in your premises. So virtualization, remote computing network is possible, easily scalability is possible, better disaster recovery is there, price based on usage. So it's always very, very cheap. This goes in crores, then this goes in lakhs, likewise. And easy interoperability because it can be accessed from any of the locations. So that is the advantage of this. Now, what are the terms this, which is very important if you are involved in a software decision for ICU? CEHRT and CEMRT, that means Certified Electronic Health Record System, which Government of India has already started in 2016, giving all these guidelines that what that software should be so that it is liable legally or it is for the security, best security. So at the end, let me finish with my talk that what will be the future. We all know that robots are going to wear now white coats. They'll be having stethoscope on them. It is happening in the world. There is in a Leipzig town in Germany, casualty is first attended by a robot. And then he finds out where these patients require to go to which department. So why this is possible is because of artificial intelligence. If you people know how to use OK Google or Siri or whatever you are using the platform, you know that it is the artificial intelligence which gives you the right kind of response. And the newer thing which has come up is a machine learning. The machine is learning everything, and that's why it's possible. Now we all know all these things. Let me end my talk with a very important technology, that all these things happens, but we always have a doubt that something goes wrong, what will happen? Something goes wrong. Who says this is right? Who says this is wrong? So friends, it's a very important, a millennium change happening in information technology, and that is blockchain technology. It's a subject altogether which requires a 1 hour explanation. But blockchain technology will clear all your doubts, and you will have trust with everybody because the information is under blockchain technology.